I'm going to tell you why I feel that healthcare is not going to be fixed, at least the way that we exist now. And I have some notes here that I wrote and outlined, did a little bit of research and looking at some of the articles, both in the news and in medical publications as to what's happening. So the media cycle tends to emphasize relatively minor health issues in an effort to deflect from what's really occurring. When we look at what's currently in the news cycle today, it's the measles outbreak and the fluoride being taken out of the water. There's a lot of news coverage right now on the new Director of Health and Human Services and on the new Surgeon General. And I believe that these are areas that should be scrutinized. I mean, these are positions of great leadership and authority, and we should be scrutinizing everything. But what's being taken as real attacks now are the measles outbreak and the fluoride coming out of the water. So far in the United States, we're in the middle of May 2025 today. There have been about 1,000 measles cases in the U.S., and fluoride is being debated on being taken out of it. These are important things. We don't want kids getting measles. We don't want kids getting cavities. I get it. I'm down with health. I mean, this is what I do every day. But when we're addressing these components, it's like complaining that there's a stain on the sofa when the house is on fire. Right? It's like complaining that someone tracked in dog poo on their shoe when there's an earthquake outside and a sinkhole just opened up. We're focusing in very much the wrong direction. Right now, the biggest epidemics that are being overlooked in the United States are obesity and diabetes, straight up. And we don't hear nearly as much about them. In this amount of time in the United States today, since we've had 1,000 measles cases, there have been over a new 1 million undiagnosed diabetes, plus all those other undiagnosed. And right now, today, presently, there are over 16 million children in the United States who are diagnosed as obese. Not overweight, obese. Right? This is an epidemic scale of problem, and those 16 million kids that are obese, those are the new diabetics of the future, right? So why are we seeing this, right? So it's because of profitability and influence in our lifestyle choices. The pharmaceutical industry dominates airwaves for advertising. The fast food industry, the ultra-processed food, the sugary drinks, the sugary cereals, they dominate media advertising. Novo Nordisk, the company that makes Wegovy, spent in 2023 $250 million advertising their drug. There were $14 billion spent on advertising sugary foods to kids last year alone, and the ultra-processed food industry is expected to top $250 billion in 2028. These numbers seem just outlandish. We're worried about 1,000 measles cases. I get it. We should not have measles at all. But we're spending $250 billion on sugar. Like, what is that doing to our population, our overall health? Diabetes cost, direct-to-consumer cost, is over $400 billion in 2022, and by 2030 the weight loss market is going to be about $100 billion. So in the next 5 years, over $500 billion on diabetes and weight loss. How much of a difference do you think we could make on tooth decay and measles if we spent $500 billion, right? The 6 major media companies, Comcast, Disney, Warner Brothers, Discovery, Paramount, Sony, and Amazon, they control most of the media that we're coming in. And these are the companies to whom these fast food industries and these pharmaceuticals are advertising. And because they're getting so much revenue, billions, almost $7 billion in 2021 alone in advertising revenue, they don't have any incentive to talk about obesity and diabetes the same way that they want to deflect and distract and cause us to think about things other than, right? So there's a public misunderstanding of critical health problems. We have a continued profitability of those components of our system that create health problems in the United States. And we rely on the pharmaceutical company advertising to tell us what to take and what to not take when we are the product. Our bad health is the product. And anything that can be fostering bad health fosters the pharmaceutical industry and the fast food industry and the sugary drink and the sugary food, ultra-processed food industry. It's a very simple thing, but the more that we can deflect, distract, push the other way, look the other way, don't look over here, the house is on fire, but look at the stain on the sofa.